33-year-old Asian woman looking to refresh aging eyelids. I'm looking for a natural look to freshen up my eyelids. I'd like to remove the slight excess skin on my upper lids, making them more crisp and symmetrical. I also don't like the hollowness, pouching, and creasing of my lower lids when I smile. One surgeon suggested to get an upper blepharoplasty and a canthopexy to address the lower laxity. Just looking for input on other options worth considering in my situation, i.e. fillers, grafting, lasers, radiofrequency treatment, lower blepharoplasty, Botox. Thanks for your time.
Thank you for your question. You're 33 years old and you've submitted several photos, one with your eyes at rest and then three with expression. And you're interested in, as you described, to freshen up your upper eyelids by removing some what appears to be excess skin and to make them more symmetric. You also state that you don't like the hollowness, pouching, creasing of the lower eyelids, and you've gone to a surgeon who suggested that you have an upper eyelid blepharoplasty and lateral canthopexy to deal with lower eyelid laxity. And you're looking for some input on other options, such as fillers, grafting, lasers, radiofrequency treatment, lower lid blepharoplasty, Botox. Essentially, you've described a whole host of solutions that are used to help rejuvenate eyes, and certainly I can understand why this could be a little bit overwhelming. Well, I can certainly help you with understanding my approach and some of the logic that I apply behind the basis of what I do. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Rejuvenating eyes has been the core of my career over the past 20 years, as I mentioned. And certainly, I would say that when we look at all of the many solutions that are available to us, it's certainly understandable why there can be so much confusion. And the point of my saying this is that every doctor you go to will bring to the table and bring to your concerns their experience and personal biases, as well as their own perceptions of an aesthetic outcome that they feel is desirable. And what's key is that you and the doctor have the same mission and understanding. So to begin with, I'll start with your upper eyelid concerns. Certainly, it is clear to see that there's a difference in the folds of the upper eyelid. Now, of course, this is in the absence of a physical exam, but I would be just concerned that at a relatively young age, how much skin redundancy is there? And the best way to determine that is with your eyes closed and to actually do the drawing and actually squeeze a little bit of the skin using an instrument to see how much extra skin there is, so that you can have an outcome where the appearance of redundant folds would look improved. Now, just to also offer a different perspective, one can also consider, in a situation like yours, the possibility of even adding filler to the brow area, the sub-brow area, the area which is above the eyelid crease and that relative hollow. It's just a perspective, because for some people that aesthetic is more desirable, of having volume there. Now, that being said, I would say that if you do have extra skin over the upper eyelids, an upper eyelid blepharoplasty is probably reasonable. The key in your situation is that the eyelid crease has to be very nicely healed, because there won't be any skin folding over to basically hide that incision. So the design and the execution of the procedure is critical. Now, that being said, discussing the lower eyelid, I think, is a little bit more, you have more options to consider. To begin with, I would question the degree of benefit there would be with a canthopexy. And why is that? Well, when you're young, at 33, and you have relatively prominent eyes, the question that would come to my mind is, how tight can you really make the lower eyelid? Can you really tighten it enough so that you would feel better about the pouching and creasing that you observe with your lower eyelids, which is seen in 3 out of the 4 photos from your expressions? My perception is that it would not make that much of an impact. That I think that what you are dealing with really is more of muscular activity. The muscle I'm referring to is the orbicularis oculi muscle, and that muscle, when you smile or you squint, bunches, and it creates that pouch. So generally speaking, the treatment that I would apply for that area would be Botox to relax the muscle. Now, the challenge here is that Botox can only relax the muscle so much. You don't want to do it too much to create laxity or worse, ectropion, but also because there is also an accordion effect when you smile. Basically, when you smile, the cheeks shift upward and the skin folds like an accordion. And therefore, you have to look at any type of intervention with a neurotoxin as not being 100%, but really about improvement. Now, when your eyes are at rest, the area of your tear trough certainly has a look that a lot of patients come to us for, which is relative hollowing. And in this area, my approach is generally to use a soft filler such as Restylane and placement into the tear trough. And this way that area can have a little bit of volume and look a little bit nicer and less hollow. Now for skin quality, we also employ something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's used to help stimulate the collagen and the blood supply and improve the texture and quality of the skin. It has worked out very, very well, and there are times we do this in combination for the best outcome. So, as far as the other ideas, such as lasers and radiofrequency, I think that more than likely the thermal energy devices or anything that causes any ablation, at this stage of your life with your skin type, I would not go for at this point. As far as the lower lid blepharoplasty, understanding that lower lid blepharoplasty aims to reduce fat pockets, any skin redundancy, and laxity, I'm not so sure that that would make enough of a difference to justify that surgical procedure. Again, in the absence of a physical exam, it's very difficult to make that decision. However, if there is any tightening to be considered, I would say that you would also might benefit from something to support the lower eyelid, which may be more involved than is beneficial in terms of the overall outcome. That's another discussion that actually is more relevant when you do a physical examination. So in summary, essentially, if you don't like the redundant skin in the upper eyelids, upper eyelid blepharoplasty does make sense. Again, absence of a physical exam, but through measuring and determining whether or not that will be effective. As far as the lower eyelids are concerned, fillers, PRP, and then possibly Botox for the orbicularis muscle pouching, or the lid roll, as it's often referred to. Meet with more doctors. If you don't feel comfortable with this doctor's recommendation, get additional opinions and get a sense of how comfortable you are with those options. But I would say that it is probably worthwhile to think of less significant procedures as a way to see if you can get the improvement you want, and before you move forward with more aggressive surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.